Okay, thank you, Ibu Lydia, and everyone. It is an honor for us to present our papers in this prestigious seminar and it is prestigious forums. Our papers title is Does Social Distancing Save Lives? The Impact of Social Distancing and Large-Scale Social Restriction on Mobility and COVID-19 in Indonesia. Why we held this kind of research since we are an economist, since we do this kind of research because now economists have a part of the health economics society. So instead of using epidemiological model or mathematical models, we are using the economical models to estimate the impact of social distancing and large-scale social restrictions in Indonesia. Second, we are also part of Ministry of Finance economists. That is today we are focusing on provides our office and the Ministry of Finance about health measurements, including for the national economic recovery. However, in these papers, we want to make a disclaimer for ourselves. This paper is made by us and not represent of our ministries. So everything about the papers is just about three of us. Thank you. Next. No. We know there is almost around the world that COVID-19 is devastated not only for economics, but also in public health. Actually, this is an extraordinary devastated economics because it started with the public health, then it's following by the economic threats. Now, until today, there is no vaccines available widely in Indonesia. Therefore, social distancing interventions becomes critical to hamper the spread of COVID-19 in Indonesia. Our papers focus on two two substantial measurements. The first one is on March 16 to 2020. Our governments introduced the first social distancing measures by what we call work, study, and worship from home policies. It requires all offices, schools, and worship places to close their door and let their employees, students, and pilgrims to do their activity at home. It's done up to, I think, about June 1st. And then the second one, there is more strengthened government's policy, which we call large-scale social restriction, or what we know it called PSBB, on March 31st, 2020. However, we know the implementations of the PSBB depends on local governments initiatives. So it will be different for each level of governments. That's what we use as our evaluations for our paper. Then, why this is also important, since right now we start to reopening the economy. To reopening the economy, we should be accurately planned, because otherwise, some research says that if the economy is not accurately planned, it will longer the impact itself. So our papers will focus on one way, how it's impact the public health, and together with other papers, government can provide like a cost and benefit how to reopen the economies. Next. Bu Nunu. Yeah. what is our data? Our data consists of two main data. Plus, we have also additional data. We are using like a Susanas for our, for examples, like weight for the populations, etc. But our main data consists of two. The first one is COVID-19. We get the COVID-19 data from the what we call BNPB for each 34 provinces in Indonesia, because we are using publicly available data. Our sample start on March 1st to 2020, and then since it's still, like Bu Lydia said, it's still on review. When we have done this research, our samples end on May 7, 2020. So it is when the period of the social distancing measures happens. And then the difference within other papers are, most papers in Indonesia usually using either qualitative or descriptive quantitative measures. We try to use to make like causal inference methods. That's why we are using daily sociality mobility, Google mobility report. Why it's important? Because it will say how are the average people in each province difference their activity before and after the interventions. That's also make us a difference from like epidemiological models and also mathematical models. Mathematical models and epidemiological models mostly, since like in China and other countries who are using epidemiological models, mostly they are using like a mathematical functions to predict the COVID-19. However, it's assumed that the people mobility is as their predictions, not what actually happens. Okay, next, Bu Nunu. This is our social distancing measures. We already told you that it's start March 16th. It's almost everyone, close to everybody's. And then what great difference in the school closures. But however, the school closures, although it's not start in March 16, not everyone start on March 16, but it's almost off in the first week of the interventions. And then next. The next, in March 31, we have like a PSBB. However, like we said before, the regulation implementation is based on local government requests instead of applied to national. So we used all of these time difference to make to create in our strategy implementations. For example, for Jakarta, it's on April 10, 2020. So we will measure Jakarta based on that date. And also the same date for other province or other administrative areas. Yes, next. So what are our identification strategy? We are using two identification strategies. The first one is synthetic control designs. Just like a quick review, synthetic control design is a development from difference in different methodologies and matching methodologies. How it's combined both, because the synthetic control design have both like treatment and controls, and they create a weighted average of the controls, which is give like a transparency and safeguards, since it suggests explicitly relative contribution to each control units. The synthetic control design was familiar by Ebedi, Diamond, and Heinmuller in 2010, and since then it's widely applicable. This is the methods, like you said, is like the first function is like simple difference in difference. We will, and then our interest is to get the alpha 1t. Why there is we call alpha 1t? Because in synthetic control define, we define for each province as the treatment unit. For example, Jakarta started in 10 April, so Jakarta is the first the first units in our papers, and the next unit, the A2 until J+1, is our controls. We know to get the alpha, we need the observed Y1t and unobserved Y1t n, and it is like the counterfactual if there is no interventions. So to estimate the counterfactual, we use the third function, which is like zi, and then also pt and I. It's the unobserved and observed. Then how the synthetic control design make this, he using like a matching things to create a weight. Next. To create weights, we get the weight W. We W2 to WJ+1. So if you see that W2 to WJ+1, so it's like a weight for all the controls. It's summarized to 1. So we estimate the counterfactual with those observed value and the weight of for each control method. So the synthetic control design itself will give us these are control that's suitable with your research. So everyone can see what are our control letters, so we can estimate impact the alpha 1t. That's the synthetic control design. Methods are used to estimate the impact of PSBB for each for each province that implement PSBB after our cut-off periods to see how it's impact the mobility, people mobility. And next, the second method is we are using event study style adapted for continuous treatment. Event study style adapted for continuous treatment is also like development of difference in difference. However, since if we difference in difference using also only one before and after, event study style mostly using like more flexible timing of impacts. In this case, if you see for the our models focus on let's see, our models in our dependent periods, dependent variables is ln y it mean ln y it -1. So it will tell us about how much is the difference of one period t and period -1, or what we can say is how big the new cases for each days. And then we estimate the models with like a sigma -1 to 7 for SD. SD is the work, study, and worksheet from home. And if we see K -1 to 7, we if you guys can see, it's like that flexible timing of impact, which is the event study style. Do it. We cut 4 days for 7 days period. Why we do this? Since from what we found in the research in Indonesia, mostly like for example, for testing, until start to testing to get like confirms methods, confirms like a COVID or no, it usually take like a 7 days period. So we use this 7 days period for those. And then we also put the PSBB, and then we also put the PPSBB, what we call here a partial PSBB, since not all the province provide PSBB, but only for city or some city or municipalities, right? And then X is including other control, which is in this case we use like whether the cases reach 100 cases in province I. It's what we done. We follow other most international papers. They since after 100 cases in each province or in each countries, the exponential things is getting higher. And then we also put like indicator whether it is a weekend or no. Since the weekend people are moving around mostly rather than the weekdays. We also put the province fixed effects to change to get the not variance by times, but changes by province. For example, like province demographics. And then also we also put like a daily fixed effects, which is time fixed effects, to cover, for examples, some aggregate measures that covers Indonesia's and everyday changes in every day, but cover similarly for each province. I think that's all our identification strategy. The next one will my friends will continue the presentations. Bu Nunu masih di mute.
Halo, Ibu Nunu, masih di mute?
We cannot hear you, Bu Nunu.
Hello, good morning.
Okay.
Yeah,
that works.
Okay, thank you. I will continue the explanation. Thank you. Okay, now the impact of social distancing on social mobility. As you see here, we have two graphs, which is the workplace mobility and this is the residential mobility. As Pak Bondi already mentioned that this data is taken from Google Mobility Report that we find quite representative to display the behavior of people, since we know that from Susenas, there are 80% of Indonesian workers own a cell phone. So we find this data already very much reliable. And this is the left side is the workplace mobility. The black line over here, the black dash line here is actually the world average of workplace mobility, while the orange one is the Indonesia's workplace mobility, while the gray line behind are actually the workplace mobility for hundreds of countries other than Indonesia. And this line over here is the cutoff of the first measure, which is the work, study, and pray from home, or WFH, in the March 16, while in here is the cutoff for PSBB, or large-scale social restrictions in Jakarta, which is on April 10th. As we see here, actually, the average workplace mobility between the world and Indonesia coincides from the mid of February until early of March. And then later, in the early of March, the workplace mobility for the world already started to decline, while Indonesia's workplace mobility declined a week later on March 16. And then following the world workplace mobility trend, yeah, and then reaching its peak on mid of April, and then going up again until now. Even though until now we're not yet reaching our baseline again, like prior to March. As we can see here, even though Indonesia, which is the orange line, decline in the workplace mobility is around 30%. But it is actually still smaller compared to world workplace average, which is 40%. So we can see that Indonesian workers are much still more mobile compared to their other countries' average. Okay, and then and as we see here, the impact of the workplace mobility, since less people go to work, then we see there is an increase in the residential mobility starting from the mid of March. We see there's the increase, even though we see that the increase in the residential mobility in Indonesia is smaller compared to the world average. And then we see that the average of increase in the residential mobility is around, for Indonesia, is about around 15%, which is actually, this is the unique fact here, which is that the residential mobility increase is only 15% compared to the decrease in the workplace mobility, which is around 30%, which means that even though people do not go to work, but some of them, you know, doing activity outside their home as well, even though not doing their activity at the workplace. So probably they go somewhere else. And then next is the impact of large-scale social restrictions or PSBB in Jakarta. As Pak Bondi mentioned, we are here mentioned that we are here to measure the impact of implementation of PSBB in Jakarta. How much is the impact of large-scale social restrictions on workplace mobility? How effective is it to actually decrease the workplace mobility? So usually when we are computing the impact of certain policy, we are usually use the standard difference in difference methods, like what we see here. This is the red line is Jakarta, and the black line here is the black line here are the other 31 provinces that we use as our comparisons. There are, we know these 31 provinces is other than Gorontalo and West Sumatra, because we know that West Sumatra on April 22 will implement PSBB, and as well as Gorontalo will start the PSBB on May the 4th. So there are 30 other provinces here on the black line. Okay, so and the cut-off here is the cut of the implementation of PSBB, which is on the April 10. So this is what we usually use to evaluate, to measure the impact of certain policies. We see the gap here after the implementations of the policy, and we usually compute this gap as the result of the implementations of certain policy. But we find here that this is actually not quite right. Why we find it not quite right? Because this 31, we see here that Jakarta actually, prior to the cutoff, prior to the implementation of PSBB, Jakarta already pose different characteristics compared to other provinces in Indonesia, which means that Jakarta has certain characteristics that differ it from other provinces. So, which is why we need to capture those characteristics, those unobserved heterogeneity, in order to get better estimate. And how we do that? We do that by implementing synthetic control design in order to get the better estimates. So what are we doing in the synthetic control design? As Pak Bondi already stated, that we actually you see this line, the yellow line here is Jakarta, and the black line over here is the synthetic DKI Jakarta. So the black line here is not the other 31 provinces, but actually only the provinces that are picked as the synthetic of DKI Jakarta. What is meant by the synthetic DKI Jakarta? It means that these provinces which are picked using our methods are those provinces who who pose the same or similar characteristic with our treatment group, which is Jakarta. Why is it important for us to find provinces which show similar characteristics? Because we really want to get a better estimate. We want to know what would happen to Jakarta if we do not implement PSBB, and that will be better depicted with the synthetic Jakarta rather than with the 31 provinces. How do we know that it is better? Now, well, let's just compare the picture. So we see here the comparison between Jakarta, which is the yellow line, and the synthetic Jakarta, which is the black line, is coincides closely following the trajectory path, better than the previous one, which is the standard difference in difference, which we see here that the gap prior to the implementation of the policy, which is April of 10, is wider. And in synthetic control, it is smaller, which means that this better reflects the characteristic of Jakarta compared to the 31 provinces. So how do we get this better synthetic? How do we get this better provinces in order to compare that, in order to get the better estimate, right? So we do that with our Stata actually has the comment already. And then we see here in table 1, the workplace mobility predictor means for Jakarta. So this is our predictors in order to, these are our predictors in order to predict the workplace mobility, in order to predict the workplace mobility and to find the similarity. So we see that this is the real for Jakarta, retail recreation is 20, then this is the synthetic is 17, and the average is 22. We see that the synthetic really more resembling Jakarta, right? So who are the synthetics? The synthetics, as Pak Bondi already mentioned about finding a province weight, the synthetic are being picked by the Stata programs, which is the West Java, and then special regions of Jakarta or DIY, and then Bali. So these three provinces, Jawa Barat, special regions of Yogyakarta, and Bali, resembles Jakarta better than any other provinces. So we are not comparing Jakarta with other 31 provinces, but we are only comparing Jakarta with these three provinces that resembles Jakarta the most. And these three provinces, Jawa Barat, DIY, and Bali, are presented here on the synthetic. And then we see, for example, here for the grocery pharmacy mobility. So this data is actually taken all from Google Mobility Report. So it's not only to workplace or residential, but also to retail recreation, grocery pharmacy, parks, transit stations. So they have really rich data on this. And then as we see, the synthetic here is 8. And then real is 6, and the average is 11. So we see synthetic is much closer. For example, here in the parks, or for example here transit stations, real is 24, synthetics 28, and average is 30. So synthetic is really giving a better pictures on how would Jakarta would be without PSBB, which is depicted here on the black line after the implementations of the policy, right? And then this is after the PSBB. So that's why we can actually measure the gap, right? This gap is what we call the impact of a large-scale social restrictions of PSBB or PSBB in Jakarta. And we found that the PSBB in Jakarta reduced the workplace mobility by 10%. Okay, so if we're not using synthetic control design, what would happen? What would happen is that our estimate would be, it would be overestimated, because we see here, this is the standard difference and difference. If we're not using the synthetic control design, then this gap is so wide that we think it is the correct one, but it will be overestimated. So this gives a better result, right? And then in order to check on the robustness, we do the placebo test. Placebo test is basically what we do is that we apply synthetic control to other provinces other than Jakarta. So to those 31 provinces, we do the placebo test. And if placebo test is considered to be, it is significant if the magnitude of the PSBB is showing the gap between the average of the placebo test, other provinces with Jakarta. As we see here, Jakarta showing the gap. Jakarta is the orange one, while the gray one are other 31 provinces other than Jakarta. And this is the implementations of PSBB. As we see here, Jakarta is the gap between the placebo test in other provinces is there's a wide gap on that, which shows that our estimate is correct, right? It's really robust. And then we, aside from Jakarta, we also do the measure, we compute the impact of PSBB in West Sumatra as well as in Gorontalo. But and in West Sumatra, they started the PSBB on April 22, and then, but we do not find the result as significant as in Jakarta. So we compute and we find around 4%. And this is the placebo test, which shows that it is closely, so it is not really showing a gap between West Sumatra with other placebo test result from other provinces, which means that PSBB in West Sumatra does not substantially reduce the workplace mobility. And it's also applied to Gorontalo, even though, yes, Gorontalo started later on May 4 of May 2020. The yellow line here is Gorontalo, and this is synthetic Gorontalo. For Sumatra Barat, West Sumatra, the synthetic provinces are different, right? So for Jakarta, the synthetic controls provinces are Bali, DIY, and Jawa Barat, but for West Sumatra, it is North Sumatra, Lampung, DIY, and South Sulawesi. So each provinces will have different synthetic provinces, right? And then for Gorontalo, they have Banten, Central Sulawesi, South Sumatra, South Kalimantan, and North Maluku as the synthetic Gorontalo, because those are the provinces that resemble their Gorontalo the most compared to other provinces. So here the placebo test also not showing quite significant gap. We compute the result of the impact of PSBB in Gorontalo is around 4.5%, not as significant as in Jakarta. The explanation to that is probably because we know that Jakarta is the richest province in Indonesia and also the capital city. So they probably have better resources to supervise the implementation of PSBB. And second of all, because maybe governing Jakarta is better in socializing the PSBB implementation, or probably because Jakarta, if we're looking at the geographical size, Jakarta is much smaller compared to Gorontalo and West Sumatra, which makes it easier for them to supervise the implementation of PSBB, and which makes them more successful in terms of getting more workplace mobility decrease compared to other provinces. Okay, I think that's all. Now we go to Pak Eko.
Thank you, Bruno. Good morning, everyone. I would like to continue the discussions by elaborating on the impacts of social distancing on cases growth. So here we employ an event study style method, adapting from Carter mentioned et al. And the difference of the study is that we also interact the event study model with the community mobility data, which is residential mobilities or residential activity. So as you can see in the left-hand side of this slide, the figure 10, the horizontal axis is the periods both before and after the social distancing periods. It is in 7 days periods. So, and the vertical axis is the COVID-19 cases growth rate. So as you can see in the this figure, right after the implementations of social distancing measures, the cases growth rate begins to decline, but the negative growth is not seen until the second periods of the second 7 days of the social distancing, which is after 8 to 14 days after the social distancing periods, and after that the coefficients on the cases growth is negative, despite slightly decline after the third weeks of the social distancing measures. So in our study, we found that after after 2 weeks of social distancing implementations, the case growth rate can be reduced by 1.48 percentage point. Next, please, Bruno. We also estimate the impacts of another measures, which is stricter measures, what we call PSBB or PSBB. We have two kind of PSBB here. The first one is a province level PSBB, and the second one is what we call a partial PSBB or district level PSBB. So on the figures at the left-hand side of the slide, you can see how province level PSBB can have impact on cases growth. The province level PSBB, which is implemented in Jakarta, Sumatera Barat, and Gorontalo, can have more impacts on cases growth, which is by implementing the PSBB, the cases growth on that particular province can be reduced additionally by like 0.2 percentage point. So with stricter measure, we can see here that tighter measure will lead to more lower cases growth. But on the other hand, we see that district level PSBBs or PSBB, which is implemented in district level, doesn't have quite significant impacts on the cases growth. Maybe because we have the observations in the province level, while the PSBB, the partial PSBB itself is implemented in district level. So maybe it's only affect a partial part of population, not the whole population not the whole population in this province. So next, please.
Pak Eko, a quick question, Pak, kalau boleh. Is this
Yeah.
cases in terms of per capita or, I mean, per million population or the total absolute number of cases?
Okay, thank you, Bu Lydia. The cases growth here is the percentage growth case from the previous day. So, for example, if today we have like 100 accumulated cases, so if the next day we have like 150 accumulated cases, so it means that
Okay, so
50%
total absolute
increase
cases number, yeah.
or growth rate, yeah. Next, please, Bruno. So based on the coefficients that we get from our model, we try to estimate how what would the case have been had the government not implementing any measure at all. So we try to use the regression estimation to estimate the predicted case. So the first one, what we were doing is we try to see how well our model can predict the cases. So at the left-hand side of this slide, the figure 13, the blue dotted line is the observed cases, so the actual cases, while the red triangle dot line is the predicted cases by which is calculated using our model. So we can see here that both lines are coincide each other. So our models can predict the cases pretty well, and we use that estimations to estimate what would the cases have been if there's no measure at all. And you can see at the right-hand side of this slide, the figure 14, that the both lines are now not coincided at all. So you can see that right after the third week of March, the red triangle dot line has its own trend, and we can see that until 7 May, the predicted cases, if there is no social distancing measure at all, we can see around 70,000 100 cases. So it's like 30% higher than the observed cases. So we can see here that social distancing can have significant impacts on the cases growth rate. The next one, please. And we also trying to calculate or estimate what would be the cases if we have more tighter measures or stringent measures. My colleagues has explained that despite significant decline in workplace activity, but the increase in residential mobility is not quite significant, or it is under. So here we try to calculate what would have been the case if the residential mobility can be increased up to like 40% or 50% from the baseline. So you can see here that again, the blue dot line represent the observed cases, while the red triangle dot line the predicted cases. That if we have more stringent measures, then in 7 May, we can have like more 40% lower cases compared to the actual cases. So it's like a 40% decrease in the actual cases. So this is highlight why it is important to have more stringent measure in this PSBB, so that we can have lower cases and there is no crowding out effect in healthcare, as well as we have a lower probability of healthcare system collapse. So this is the result of the second sections, and we will come to the conclusion of this study. That we know that the social distancing measure, which includes work, study, and pray from home activity, can decrease the workplace mobility by 30%, and it also can increase the residential activity by 15%. And we see that the large-scale social restrictions, or PSBB, can have impact like 10% decrease in workplace mobility in Jakarta, but we do not find similar pattern for the other provinces in West Sumatra and Gorontalo. And we also find that these measures can have significant impacts on the cases growth. And if we don't have these measures, the cases would be like 30% or 40% higher than the observed cases. And the next, some recommendations for the policymakers, perhaps that if we want to gradually reopen the economy, then we have to consider also how we can give some measure to the community, so that the gradual opening of the economy could not have adverse impacts on the community health. So perhaps as we know that recently the cases is growing very significantly, we should implement more perhaps more restrictions, or we could give more public education, so that the cases growth in the futures can be handled correctly. Thank you very much. This is our presentations. Maybe we can have a fruitful discussion ahead. Thank you.
Thank you for the presentation, Pak Bondi, Pak Eko, and Ibu Nono. So it's time for Q&A. Please use the raise hand function. You can find the raise hand function underneath, or you can click participant and point to your name and then right click and you can use the raise hand function. So while waiting for people to ask a question, oh, I see Juventus already raised a question, but can I ask a couple of questions from for myself? The first is, in terms of number of cases, have you considered standardizing the number of cases based on the population? For example, you know, the number, the cases per 1 million or so. And also, is there any way to take into account about the number of testing? So because if you don't test, you have 0 cases. That's what Mr. Trump always say, right? But is that something that is considered in the model? And you had mentioned about stricter measures, that if you implement stricter measures, lower cases. What are the stricter measures that you are thinking about in this term? What kind of policies, additional, I guess, policies needed for making it stricter? So I see Pak Juventus asking, raising hand. Silakan Pak, I have asked you to unmute ya.
Thanks, Bu Lydia. Thank you for the presentation, Pak Bondi, Bruno, and Pak Eko. I just have one question about the weight when you construct the synthetic control. I think that's the most important part when you construct the synthetic control. I just wonder, did Stata do all the selection, or you assign some, assign some province, or it's automatically done, or you have to choose some characteristic? If you choose some characteristic of the province that resemble Jakarta, then I just wonder whether you did a balance test on the characteristic, make sure that there's no difference between the province that you use in the synthetic control and Jakarta. I think that's all. Thanks.
Maybe we can answer the question first while waiting for other people to raise, to pose their question. So is Pak Eko or Pak Bondi or Ibu Nunu will be answering the question?
Okay, thank you, Ibu Lydia. Maybe to make my colleagues more exciting, I will start to create the discussions about Bu Lydia and Pak Juventus questions, and maybe my friends will add some more later. The first one, do we standardize of cases? We do not standardize of cases. Why? We look at the cases from 7 May. If we compare to our province populations, it will be super small at that time. So it will be that's why we don't do standardize the cases. However, we have tried that before, but that it's super small numbers of cases, because it's like a 0 point something, kind of like that. But however, to address these questions, we already use the population as our weight. So we weight the populations based on the each province populations. And then, do we use a number of testing? This is a very, very good question, because like Julia said, Trump says that if you don't do tests, and there is no cases at all. That's really true. However, when we do the when we do the research, at that time there is no publicly available PCR testings that are available for each province. There is like starting aggregate PCR testings. PCR testings, I think, is since April somethings. We already get that. However, it's not by province levels. It's on by aggregate because we are using available data. So how we address those questions? We address those questions with two parts. The first one, we use like a time fixed effects. So since we are using a daily time fixed effects, if there is a testing who are like, for example, with a similar trend over time for each province, it will be somewhat captured by the time fixed effect province, since we do the time fixed effect province by daily. So it's like if we increase the testing from 1,000 to 2,000 in each day, so it will be captured by time fixed effects. And then we also use like province fixed effects, so it will capture the characteristic. For examples, our research today, our next research, we also see how big the difference of testing between province. What we find is it has like a similar trends. The province which have low level of testing will have low of testing for the similar for the next days, for the next week, and for the next month, and it has a similar level of correlations between the testing levels and the confirmed cases levels. So with those two, we try to address those questions. And then the third question is, what is the restrictive measures? Since our paper show it could be like more restricted measures to get more people like in home. What we thought about it's about, we have like decrease about 30% of work from home, but then only 15% from residentials. So what we need to stricter measures, I think it needs to make sure that people are stay at home. For examples, in any other countries, there are more better like socializings, and also better like enforcement levels. For examples, there are like I'm not sure, maybe like a policeman or something to make sure that people are not going anywhere. However, even though this is not in our scope, we also need to think about the cost and benefit of this kind of more restrictive measures, because it's like the cost and benefits is like how it's affect economy, right? And then from Mr. Juventus, how we do the characteristics balance. I'm not maybe Bu Nunu will give like a better explanation for this, because she is doing the job very good.
Okay, thank you for Pak Juventus. We actually we usually okay, I think this one, right? How do we determine the syntactic provinces as the comparison? So we do this actually already all provide in Stata. So we already have the province weight and everything, and then we just run it, and then we get this Jawa Barat and DIY, and then Bali, and then we also can see how the means, if we compare the means between real, synthetic, and average, we can see as well how the synthetic really much closer to the real Jakarta, if we compare with the average of 31 other control provinces, which is why we believe that, as we see, for example, here, the synthetic shows 11 for workplaces March 21, and then the real is 10, and then the average of provinces is 8, and then this is 39, this is 43, and the average is 30. So they are much closer compared to this average, which we see that is quite representative to actually resemble and becoming our synthetic, resembling DKI Jakarta, as well as other provinces, which is the treatment group, whether it's Gorontalo or West Sumatra. So how about that? Or Pak Eko, would like to add some more explanation? And actually, I just want to add as well, when it comes to number of testing, I know that this is such an issue, and we'll just teaser. Actually, currently we are working on the project, Bu Lydia, on how we try to estimate the unreported cases using the number of testing data, even though we have to admit that we find difficulties in collecting the testing data. And what we find is that for Jakarta, we have the data but unfortunately, as Pak Bondi said, other provinces, we do not have the daily data for the number of testing. So it will be on our next project.
Okay, maybe I would like to add the answer for Bu Lydia questions. The first one about the model. We use the log difference in cases growth. So because many of the study in epidemiological models assume that the cases can grow exponentially. So and we think that if we rescale it using the populations, it will make no difference since populations of the province do not change for the period that we use in the study.
Okay, Pak Juventus, did you want to add anything else to your question or comment? I think it will be good to get some input on the modeling aspects to strengthen the paper. If not, anybody else, if you would like to pose a question, feel free to ask ya, untuk menanyakan dalam bahasa Indonesia, silakan bisa ditanyakan juga. Kalau tidak ada, mungkin dan kita juga sudah sampai ke waktunya ya. Anyone else would like to ask, to pose a question, or researchers, if you want to add additional comment? I mean, personally, I find that this is very good research. Yeah, it's really interesting to see how you really take very good care in making sure that you think through all the possible variables. Ya, oh Pak Maxensio, saya lihat akan mengajukan pertanyaan. You can unmute now, Pak.
Yeah. Baik. Thank you, Lydia. Can you hear me?
Yeah, Pak.
Okay. I think, yeah, I think congratulations. This is really very, very good research. And I think, yeah, as Pak Boni say in the first part of the presentation, I think we can get more exact number regarding how effective kind of social distancing, with regard to the number of infections. But as a previous question or concern rise, actually I'm worried about the number of testing, because it seems that this is really kind of local political issue, right? The good way not to increase the number is don't do testing, right? So I think if we can get more testing, of course the story will change, because because this is kind of issue that never say in the proper way by governments. How many testing have been done in which province, how many, and so on. I think that is the most important information that need to be grabbed to enrich this study. So that's my first comment. And then the second comment, actually, this study also gives some insight in relation with the saving people is mean that we can minimize the infection, right? So if you save people, that will have impact on economic activity. So with regard the number that you give to us, actually, can you give such insight how actually the economy will have such impact on the effectiveness, on the restriction itself? Can you give such your explanation? How about the economy issues, the implication of economic issue from your study? And finally, my last comment: did you take into account the impact of Idul Fitri in the exercise? How it may change also the result? And of course, finally, that's a good strategy to do synthetic control design. But I don't know. Every region in Indonesia has their own characteristic in terms of economic activity, culture, and so on. So of course, this may be the good strategy to find more the same characteristic. But if we look more deeper and the micro levels, of course, the characteristic will be much diverse among the regions. That's just my comment and maybe some questions. So congratulations again for this study. Very, very good. Thank you, Mbak Lydia.
Okay, thank you. Maybe that's the last question. Silakan Pak Bondi dan rekan-rekan.
Okay, thank you. Maybe I would like to give like some answers from Mr. Maxensius. The first comments from us is we are very grateful for your comments, that it is a very good papers. I hope it will be a good insight for everyone. And then for your questions, worried about number of testing. Don't do testing, story. If we don't do testing or we do more testing, the story will change. I think we are completely agree with that. If we could get the testing numbers, availability testing number that we can get, that will make change different. Make any difference. However, we also use like some view placebo test and robustness check to check if there is like unobserved variables that could affect our results, right? So if we see from the slide in here, Mrs. Nuno wanna put like, could you give like Pak Eko slides, the graph. So if we see in here, not this one. Okay, it is okay. If we see in here, in our placebo test, if we see in here in day 1 to 7 and -6 to 0 and -7, or the right, the left hand side of this graph, which is the first 3 dots, it sees no significant impacts before the intervention. So it says that any unobserved impact does not affect, does not change the results, since we find it's insignificantly change the results if it is before the implementations, but then it's also get the result impact when it is go to the right hand side. And then Bu Nunu, can you give the next slide for Echo and another one? Another one, yeah. And this we also see, yeah, that one. Okay, and in the right sides we also see hand right side. We see that before the March 16 or the mid of March, our estimate is coincidence with the actual cases, which is the which is covered by the graph. And then we also use the, like I said before, we also use the province fixed effect to get each characteristic, including how low the testing rate for each province is. And then we also use the time fixed effects, which is every day, to get like somehow how much the testing will difference. However, we completely agree, if we could, this paper could be better, maybe for next researchers who want to do it. If there is like a test number of testing, how may it change from our papers? And then actually we start for our next paper, we start to do like Bu Nunu said, start to do with the number of testing. However, the number of testings today, we still have like a difficulties how to get those numbers in a good shape.
Only
and then
Jakarta, Pak. We have only Jakarta daily.
Yeah.
The provinces we don't have.
Yeah, we try to like another measures to get the testing so far. And then number two, in saving people means minimize infection. How can you inside the economy will have such impacts? Actually, this is in out of scope of our papers. We don't do how it's impact the economies. However, if we see our papers, see the impact is a 1 month period, say like a 16 March to like a May, maybe 1 or 2 months. It could create a difference about 37% increase in cases. So like we said, if we increase in cases, so it would increase in people awareness, and then it will decrease the mobility, and then it will like decrease economy to possibility to economy to recovers. However, we don't since it's not our in our scope, we have no numbers to estimate how big is the impact to the economy yet. Maybe another paper will do the same things. And about the Idul Fitris, we don't honestly, we don't do get the Idul Fitris variables. However, we put the weekend, since we see the weekend people more likely are, for examples, they are more likely go to the outsides or otherwise. So that's my my comments. Thank you for Mr. Max for the very good insightful comments, and maybe my friends will add some additional comments.
Okay, thank you, Pak Bondi. Pak Max, thank you for the question. So I will try to touch a little on how the economy will have the impact. As Pak Bondi says that our paper, actually our scope of the paper is not touching on the economic side. However, we know that a lot of experts, including Pak Khatib Basri, also mentioned and how this crisis is very different with the previous crisis in 2008 or in 1998. So how it's different because the mobility is depressed, reduced. The reduced in, as we know that when we're dealing with crisis, is always the government try to implement policies to increase the demand sides as well as to maintain the supply side. But in this case, because of the need to reduce the mobility due to health concern, of course, it will also have the impact on the slowing down of the economic recovery. Well, I will just probably give the slide from, actually this is not from our paper, but just give an insight. This is from McKinsey and how they try to show, to compare. So the black line over here is actually the stimulus in
sorry,
2008.
Ibu Nuno, it's not showing the slide.
Oh, okay.
So I think you should itu dimatikan dulu ya, to share.
Oh, okay, I will. Okay.
The other one, yeah, yep, sudah ada.
So I would just want to give an insight. Yeah, even though it is not on our paper, but this is what happened today. That this is the extraordinary policy stimulus globally, and then we see this, the black line here, 3.5% of the GDP is the stimulus in 2008. So the black line over here is the stimulus on the 2008, and the blue light line here are the stimulus for the crisis nowadays, which is 2020 due to COVID pandemic. So we see how the magnitude of the stimulus is very, huge, like 10 times of the stimulus in 2008. Why is that? Because of this extraordinary situation. And I believe that many experts believe that it is due to the fact that not only that we deal with the crisis, but we also have to deal with the reduce in the mobility, which of course affects on the demand and supply side of the economy. So probably I will try to show how mobility could actually also have the potential to slowing down the economy recovery. As we see also the stimulus is like 10-fold. So we see how many people see that. And on the questions, on comments of Pak Max about synthetic control design, capture the characteristics. Well, actually that's why we try to do. Usually people are using the standard different and different Pak Max, which is why now we are using the synthetic control. Hopefully, if there is a better way, a better methods to capture that, then we'd love to do it as well. So yes, which is why we are using the synthetic control design, because this will capture better characteristics on certain provinces, as Pak Max already said that yes, every country, every province, like here in Jakarta, the red line prior to the PSBB already showed the different characteristic with the other 31 provinces, which is why we are implementing a synthetic control design to better capture the characteristic and actually give better estimate. If in the future we'll have a better method to capture the characteristic, then we'd love to have that in our paper next project. Thank you.
Okay, thank you. Thank you very much for everyone, and particularly for the speakers. It's really a great session of FKP this morning. I just want to remind everyone that we will have another event on Thursday, and that is also on